Good afternoon, everyone. Thanks for joining us. We have a lot to cover. I do want to mention that we do not have our American Sign Language interpreters this afternoon, so if you need to turn on live captions, you can do that by clicking Settings and turning on Auto-Generated Captions. So if you do need those live caption settings, and you need that live caption setting, click on Settings and then turn on Auto-Generated Captions. Let's get caught up on the dashboard and some of the data points. So we're at least currently we are tracking 576 active cases, and I'm going to use this. We're going to go back and forth among some data points in a moment, but 576 active cases, 257,868 tests conducted these last 10 months. 176 individuals have succumbed to the disease, 32 have been hospitalized, and we currently have a regional positivity rate of 3.7%. None of those numbers are going in the right direction, and this is something we knew would occur as we get into the winter months. I want to be clear, we're not here, county government's not here to frighten anyone. We're providing what is important information, and then you and I have to make decisions to protect our health and the health of our loved ones, neighbors, and friends and family, which I assume are people you love. I just want to be clear about that. We are seeing what was expected, this next wave, and that wave is cresting. And if you look west of Dutchess County, you can look to certainly the Midwestern states. You can come into Ohio. Western New York has one of the highest positivity rates in the state of New York. If you look to the western part of the Mid-Hudson region, you can see those cases and those positivity rates increase, and it is creeping our way in that way again. Now, of course, part of it is that there are identified clusters, and you can point to some of those certainly outside of Dutchess. And then part of it is we have either become deliberate in that many are just choosing not to engage in some of those safety precautions, and we've become casual. Some are just casually forgetting and taking those safety precautions, and we're seeing the transmission of the disease. Now, as I said, hospitalizations, active cases, and deaths associated with COVID-19, those numbers are rising at a pace. Deaths, we've seen sadly a handful these last several weeks. Hospitalizations in particular are rising at a rate that should concern us. And hospital administration here in Dutchess, the administrations of the Vassar Brothers Northern Dutchess Hospital network, and of course Westchester Medical here at Mid-Hudson Regional, have all put into place some of the same safety precautions they took earlier this year, because they too are concerned about the rate of growth among hospitalizations and total positive cases. And again, we know that as we see the new cases come, now 576 active cases, within 7 to 10 days, if those cases become a bit more severe, we'll start to see increases in hospitalizations. And there has been this steady pace over the last couple of weeks. So let's talk a little bit about the local cases and what we know. So where are Dutchess County's cases coming from? Principally from community and community events and socialization. So again, I know that it's easy. Well, I saw masses of people marching or doing this, and were there cases? Yeah, there were certainly cases. But what we do know is that when we do the contact tracing with positive cases today, those cases trace back to the sort of deliberate, community interaction and social interaction, and all of it's understandable. And I don't think it's fair to say to people, well, you're at fault because you did these sorts of things. We understand why human beings act in that way. We all do. The case here is we just have to be sensitive to it. We have to be considerate, and we have to be deliberate in taking those safety steps that will protect our health as individuals and the health of friends and family. Most of our cases are associated, as I said, with social events and that interaction, household transmission. Understandably, someone starts to exhibit some symptoms. They're in the same household. They transmit, and the disease, it's contracted from someone who is in that household with symptoms. We see a lot of that, and we are seeing travel-related positive cases. And again, It's not that any one of these is entirely the concern. They're just all areas that we can trace back our growth in cases to, and why we have to be smart and deliberate and considerate about our health and taking some of the steps. Good news, we have not identified any new clusters in Dutchess County. So beyond those that we identified a week ago, we have, of course, we spoke to the cluster identified at Marist College, the cluster at the FISHKILL Rehabilitation Center, and nursing homes and group homes. Now, currently at nursing homes and group homes, we're looking at staff cases only. Keep you posted on any growth or any change in that. So we want people to be safe, and we want people to be smart and be considerate. And certainly going into the holiday, Thanksgiving holiday, Wednesday before is generally nice. It's usually a hangout day for folks coming back from college. Now, many of them didn't go away, but some did. It's just not the time to have those kinds of parties and gatherings. Try to stay with friends and family that you know, that you trust, that have sort of taken the basic precautions, and then engage in those safety steps as well. Thanksgiving, again, keep those holiday activities small. Focus on some of those safety measures. If you have symptoms or you're not feeling well, this just isn't the year to go out. Stay at home, and hopefully you have a family member that loves you enough to bring you some turkey. But that said, try to keep those activities small. If you have a question, write in the comments section below the live stream. We'll get to that. We have been pushing out a lot of really informative information. I'd encourage you to visit dutchessny.gov. Of course, follow us at Dutchess County Government on Facebook and Twitter. And also look to regular updates from Dr. Anil Waidyan. He is our Commissioner of Health, the Department of Behavioral and Community Health. Dr. Waidyan is an infectious disease doctor. He actually came to us from Rockland County. I feel like it was many years ago, but it was only a couple years ago. And this is his area of expertise. He's very deliberate, very thoughtful, and very professional in his advice. I really would encourage you to watch his video updates. He takes some of the questions that you have throughout the week, some of the complaints that you have, some of the messages that you post, and we try to distill it, and he provide a bit of an update from a physician's perspective, someone who has a life experience in infectious disease. And he's providing those every Monday and Friday, and you should look for those regularly, again, here on Facebook, Twitter, and on the county's Facebook page, and we provide you some update. Let's jump to the the regional data points, and I do want to get to that in a moment. I want to point to that. So the regional infection rate, as I mentioned, was that 3.7%. That's of all the counties, sort of blended together. Dutchess, this is what we've reminded folks many times before. We have a positivity rate day to day, and then you have this blended rolling average. And Dutchess County still maintains one of the lowest 7-day positivity rate, that average in the region. Ulster and Dutchess sort of compete for that lower end. That is just a moment in time. We know that the wave is cresting. It is likely going to crash on the region, and we are going to see new cases. Now, the way to address that is to make personal choices that slow that rate of growth, and hopefully we don't see the kind of crash on us that would be certainly problematic for individuals' health and for the hospital system. But the region, again, Dutchess is at a 3.4% positivity rate yesterday. And as a reference, if you look at the slide here, you'll see that Dutchess County's 7-day average is 2.5%. Ulster County's 7-day average is 1.9%. However, yesterday's percentages are Dutchess 3.4, Ulster 12.4. And again, that's simply a product of the number of positives divided by the number of tests administered. So you could have the same number of positives, fewer tests, higher positivity rate. You could have higher positives, same number of tests, higher positivity rate. So that fluctuates. The day-to-day fluctuates. The 7-day rolling average is what we also pay attention to. And again, if you look at that, we always end up competing for the lower end. But again, as I said earlier, what we're seeing basically are cases start to grow. You can almost feel it from west to east for whatever reason. And I think to some extent it's because you all have been making really smart choices, and we are seeing people follow the basic guidelines, and we'd ask you to continue to do that. Deborah is asking if the virus can be spread by smoking And I don't want to answer that question. So we'll make sure that we get you a doctor's answer. But I do think that the answer is yes. We saw this in Italy, where the feeling was because there were so many individuals who did, in fact, there was a lot of smokers, but there were also a lot of underlying health concerns related to smoking that did cause more severity in cases and ultimately more deaths. But let's get a doctor to answer your question. Off the top of my head, I don't recall the guidance, but there is a concern regarding smoking, regarding vaping, and being able to transmit in the water droplets or in the droplets as you exhale the disease. Let's get you a medical professional's answer, and if somebody is paying attention and wants to reach out to Dr. Wythian before we finish today, I'll try to give you an update. Terry is asking if it's up to the school or the governor to close schools. Tricky question. So the state has rolled out this micro-cluster framework. Do we have a slide on that? We don't. So if there is a zip code or geographic area that goes above a basic threshold, schools may have to close. That's a decision of the state, right? You meet that threshold, you close. But the state did leave to school districts the ability to make those choices. And so school districts, some want to plow ahead and try to and just stay open as long as they can. Some are concerned about the rate of cases and may choose to close. Those are decisions that within the framework that the state established, school districts can make those choices. However, when numbers start to get larger and the positivity rate exceeds a certain threshold, I think it's 3% on the 7-day rolling average, a school district in a particular zip code may be forced to close, test if residents, family members want to participate in that test, and if you stay below a threshold, you remain open. If not, you'd have to close, and then so on. Higher the threshold, less likely you'll be opening school. So it's a little bit of both. We're focused on that. We had calls again today. Our team has been meeting every week with public schools since February. We had another call today with public schools and private schools to give them an update on the micro-cluster response, what we see in our numbers and what they ought to brace for, and those decisions are going to be complicated. One of the issues is we're not seeing transmission necessarily from school activity. In fact, if you look at positivity throughout the region and the state, it's not school-centered. It's usually community-centered and then brought into the school. But what that means is if you send your child to school with symptoms or they happen to be positive, and of course they threaten their health and the health of others, anyone they come into contact with is also then susceptible, obviously, to contracting the disease and is required to quarantine. When that happens, and enough students or staff are required to quarantine as they await testing, or worse yet, do test positive, there isn't the staff, or certainly there wouldn't be the students, to stay open. And what we're seeing is a number of school districts have had to close individual buildings because they just don't have the staff to support it because of the potential, because of the contact that staff may have had. They just don't have staff to bring in. So I personally know this. The Red Hook High School had to close for that very reason. And so they went remote for a period of time, in fact, through the end of next week. So keep that in mind. Jessica, any word on schools going remote between Thanksgiving and Christmas? I mean, the short answer again is, as of today, there is not a state order to do so. School districts may choose to do that based on their own numbers. We're not suggesting they do one thing or another. I will say this. Schools being open have their own complexities, right? The logistics that they've had to work out to keep everybody safe, to be able to provide the services. We've always said in-person education is the best option. If schools choose to close, yes, they may have a remote model, but of course for families, where do kids go? And the challenge is once school buildings close, young people may have to go to daycares, they may have to go to remote learning centers, and families have to scramble to support that kind of thing, and that's hard. It's hard for a lot of families to be able to do that. The other is you're taking kids from a more restrictive environment, meaning schools have to follow very specific safety guidelines that the state imposed, to perhaps other environments that have less restrictions. And therefore, from our perspective, it is, as a child, safe to be in the school building, and certainly you're less likely, based on the data, to contract the disease in a school building than you might be in a less restrictive child care or remote learning structure. And that, of course, is something that families, school districts, and we all have to weigh. But as of this moment, Jessica, there is no stated plan for closing schools between Thanksgiving and Christmas, but it is a likelihood for some, and it is a decision that those districts will be making with the data they have and with families throughout their districts. Stephen's asking how many active cases are in prisons, jail. Currently none. There was a spike, if I remember correctly, recently from what we refer to as a data dump at New York State prisons. We don't have, as far as I know, any identified positive case at the Dutchess County Jail. I will confirm that. I hope I'm right. That's based on my own memory. No positive cases at the Dutchess County Jail among inmates. There are positive cases among inmates and staff in state prisons. Those numbers are in the database, in the dashboard. As I said, when you see a spike in that, there was, I think, about a week ago, a spike. Those were jail related. You can, I think the state does provide some data on jail cases. If you go to the state dashboard, you can find some information about that. We only get what the state gives us when it comes to state prison facilities. And of course, if it's a Dutchess County resident and a Dutchess County inmate or a Dutchess County corrections officer, we would have that embedded in our data as well. So if you have any other questions, write them down in that comment section below the live feed. We'd be happy to get to them. As you know, a few new guidelines came out last week. They went into effect last Friday. We have an answer from Dr. Wythian. So Deborah, Dr. Wythian says there is no data on smoking inside, close to each other, sharing air. That's the risk. So specifically, he's saying we don't have data to prove or disprove that smoking is a transmitter of the disease. However, being inside close to one another, sharing that air back and forth is a risk. And so, I mean, certainly if you're smoking in your backyard, you shouldn't. But if you're smoking in your backyard, smoking's bad for you. Even though I know it's difficult to quit, there's not that risk. But of course, it's that close proximity, and that's what Dr. V has just provided us. So thank you, Anil, for that update. A couple things restaurants, bars, these are the state guidance. I'm telling you what they are. No in-person dining after 10 p.m. Gyms have to be closed after 10 p.m. And personal private gatherings in homes need to be limited to 10 people. In Dutchess County, we're encouraging you just to keep your gatherings small. That's all. Be respectful, be sensitive to one another, and everyone can play their parts to ensure you have a safe Thanksgiving. I was told today the governor stole my line. I don't know that he did, but we said, don't be a turkey, wear your mask, keep it small this Thanksgiving. But nevertheless, give a lot of credit to our graphics team. Thank you very much. Lovely turkey wearing a mask. He looks frightened. That said, keep it small. That's all we want. We want you to be considerate and deliberate in making the choice to keep your holiday gatherings small. Obviously, if these are family members that have all taken steps to be safe, then you have less concern. If they're family members that you really don't know, remember their social circle becomes your social circle. So when you get together, if they had some interaction with someone who had contracted the disease, it is possible that they could be bringing it to your home. So just be sensitive to that in your own home and for social gatherings like that, right? Holiday gatherings, get-togethers. Just be aware. You do want to keep some space from one another. If there is some concern, maybe you should be wearing masks. So those are things that you want to consider, you want to do. We want you to keep those activities small and to follow the basic guidelines, and we appreciate that. So I mentioned the microclusters and the state's response. If you have time and you choose to, it's helpful to us if you download the New York State Contact Tracer application. This is a tool that you can use on your personal handheld device. I know there's always concern about this. There isn't. The state has assured us that there is no capacity. They're not stealing information. But this is a means that if you have come into contact with an individual that maybe is tested positive, the app will alert you. It'll just speed up the process. You'll be notified sooner. You can make choices based on that information sooner. And as we have to conduct the contact tracing, it'll make this connection happen that much quicker. And so we'd encourage you for your Android or Apple product to download the COVID Alert New York app. You can find that in your app shop or app store and make that decision to activate it. And again, it's by your choice, but it's a tool that can be helpful to all of us. Just a few other things to kind of get through. This is a year to get the flu shot. For those of you who choose to do that, I got mine, my family has theirs, and the county had conducted 2 drive-through flu shot clinics for senior citizens, thanks to our Office for the Aging. Again, because of COVID, we just don't want to strain resources. So the point here is, right, if we're dealing with the flu and we're dealing with COVID, physicians' offices, hospitals become that much more stressed. So if you choose to get the flu shot this year, you can obviously access that through your physician, through a local pharmacy, and through several retailers like Walmart and Target. And of course, the Dutchess County Department of Behavioral and Community Health conducts a flu shot clinic on Mondays by appointment only. So reach out to us at dutchessny.gov/flu, dutchessny.gov/flu. Tonight, the Dutchess County Legislature's Budget Committee will take up consideration of the 2021 budget that I submitted to them. If you have some time, take a look at our interactive budget webpage at dutchessny.gov. Learn a little bit about the proposed budget. You know, we're doing great things with less resources. We're hunkering down like everyone else needs to, tightening our belt. No tax increase, no layoffs. We've shrunk the county's workforce, and still, by cutting some spending, we're even broadening our reach when it comes to certain services. We're able to do that by partnering with not-for-profits and really just being more creative and more innovative. It'll be a real stress for departments and county employees, but they're up for the task in 2021. And if you'd like to learn more or participate in another one of our budget-related town halls, you can do that on Thursday, tomorrow, November 19th at 6 p.m. Thursday, November 9th at 6 p.m. What is the threshold to close schools? Michael, thank you. Medium risk is 5 to 8%. So first let's start here. If you get up to 9%, schools are supposed to close. So if the rolling average for the region and the county is 9% based on the state standard, we're closed. Within those micro clusters, so if it's a zip code or geographic area, so I'll use mine. I live in 12571. That's my zip code. If my zip code exceeds 3% but is below 5%, my schools, Red Hook schools, can remain open, but they must conduct regular testing to stay below a positivity threshold. So that's the yellow zone, right? Green. Yellow, orange, red. Yellow zone. They remain open, and they just need to meet the testing requirements. So, Michael, when we get to 5 to 8%, they are to close, remote only. Now that they can test out of that, meeting certain standards, but the expectation is you're closed, and above 8%, you're closed. So that's the threshold in a zip code. So right now, the county's at 3.4%. Yesterday, 2.5% regionally. So we're still below 3% within the entire county over the last this 7-day rolling average. But there could be zip codes. We know there are zip codes, certainly, that are higher. We don't get that data until the state provides it to us. But as it becomes available, if there is a concern, that will be that will be what triggers whether or not a district moves to or building moves to this testing requirement, yellow zone, or the closure requirements, orange and red, and we keep you posted about that. Felicia, can you spread it by cooking food? Dr. Wythian says if you don't have symptoms, if you're not sneezing and serving, if you're washing your hands and taking personal steps to be safe, you are unlikely to spread the disease, and you should always, if you feel, consider wearing a mask. You might not do that with your spouse and your kids, but if you are having a few family members over, you may choose. If I'm cooking, what have you, I may, or serving, maybe I put on a mask and slow the spread in my own house. But again, Dr. Wythian, infectious disease doctor, I like to say that, this is his professional background. Not a major concern if you're not symptomatic, if you're not sneezing and coughing, and if you're washing your hands. Now, the other thing is what I will tell you is, as my wife reminded us months and months ago, it's probably good not to sneeze in your food anyway, and it's really good to wash your hands often. So no matter what it is, just take those steps, limited risk for exposure. Is OPWDD going to follow NICED for closures? The short answer is if they're school-aged, technically OPWDD programs would have to match the closure requirements or the restrictions that the public school would. But that's not universal. So again, if it's school-age and school-age services, in theory, they would have to meet those same basic expectations for those thresholds. We're not there yet. And what we'll try to do is give you a specific update on what those requirements are for OPWDD, this Office of People with Developmental Disability Services. And certainly we know the risk and we know the challenge many have living with intellectual and developmental disabilities, and what that might look like. Okay, so we'll get you updated. But again, if they fall within those zones and they're school age and school related programming, it is likely they have to meet those same restrictions. If not, it is not likely they fall within the New York State education requirements. So Dave's asking how the Amazon deal is looking. So far so good. Now what I'd offer to you is so this is the former IBM facility in the town of East Fishkill. Really great opportunity. This is part of a larger development plan that has included many great small businesses and medium-sized businesses. Sloop Brewing, one of my favorites, is there. If you haven't, well, never mind. I was going to say try the juice bomb, but I probably shouldn't say that. Nevertheless, a good mix of businesses. So Amazon is looking at this facility. It's just under 1 million square feet, I think, 600,000 square feet, as a logistics center. Now, what is that? That is not a fulfillment center. Fulfillment center is where if you order from Amazon, when they're finally putting the product in that brown box and sending it to you, that's the fulfillment center. The logistics center is where regionally businesses that do business with Amazon, and we are seeing a lot of small businesses have made the leap to do some sales with Amazon. Those products get to a logistics center, and that logistics center then sends it to the fulfillment center to get in those brown boxes and come to your house. So we believe in a nice diverse workforce. We continue to support small and medium-sized businesses. This is a proposal. The town of East Fishkill has worked very hard to make this property attractive to this kind of investment. We're grateful to Supervisor Nick D'Alessandro and the town board in the town of East Fishkill. So right now, within 30 days, Amazon will have to make a decision. It's not a competition. They're just weighing out their options. And within 30 days, Amazon will make that determination. We feel very confident. It's not done, but we feel very confident. It's a $135 million investment with 500 annualized new jobs. And what I mean by that is, so for instance, the Gap, which is a distribution center in Fishkill, another center right there on Route 84, they have a base number of jobs. And offhand, I don't know if I can remember that number. I feel like it's like in the 250 range. But nevertheless, they have a base number of permanent jobs, and then they expand based on need, demand, and holidays. This is 500 jobs all year long. And so $135 million investment, 500 full-time equivalent full-time jobs for a year, annualized, meaning no fluctuation expected. And they're going to take a property that currently pays, I think, $150,000 in taxes in that neighborhood, and pay $1.5 million in property taxes, and then incrementally increase that over a period of time. So we feel very confident about it. We think that it is likely, but Amazon has 30 days to make that decision. Are hair salons still okay to be open? Yes, they are. First, they can be open. Yes, they are open. And we are seeing very few, if any, cases related to folks getting their hair done. If you go now, remember the barber, hairdresser, stylist must wear a mask. The customer, you, must wear a mask. And they can do their work, and so far they still do remain open. Can I travel to Connecticut? Why? No, I'm kidding. Yes, you can. However, remember the states of New York, New Jersey, and Connecticut have basic travel guidelines, but the states immediately adjacent to New York, the states are asking that you just limit that travel. So again, if you're going to go there to go shopping, I suggest you shop here in Dutchess County. If you're going there to visit your family, or there's some essential reason to do that, it's certainly permitted, and the state isn't asking any questions in that regard. And again, just be sensitive to your health and the health of the people that you're visiting with. I think that that's an important thing to keep in mind. Now, if you do travel, we have the travel advisory. Basically, if you travel anywhere across the country, this is what the states at New York, New Jersey, Connecticut, Massachusetts, and Vermont are asking. Excuse me, I apologize. New York, New Jersey, Connecticut are asking you to do this. So if you're going to be gone for more than 24 hours, you should test within 72 hours before returning. So you're going off to Virginia. You're going to test within 72 hours before returning from Virginia, and then you are to come back home, quarantine for 3 days, and test on the 4th day. If you test negative, go about your business. That is the expectation. Now, you can't exit that quarantine period with 2 negative COVID tests. That's the state expectation, and that's what I got. Dana, with increased numbers, is indoor dining going to remain open? The short answer is at the moment, yes. We haven't met thresholds, and we're not exceeding areas of concern that the state and the governor has decided to make any particular action. And I just would tell you, we really want to be certain. And if you don't want restaurants closed, and we want schools to remain open, and we don't want the restrictions that we've seen, there are a couple ways to do that. One of them is to make those choices to be safe about our own health. And again, physical distancing, small social gatherings, not large events and activities, and wear a mask. Do those things. Watch out for your own personal health. Wash your hands. Be considerate of others' health. If you have symptoms, don't go out. Stay home, please. We'll be able to slow the rate of growth and remain active. Can't tell you what the state of New York is going to decide when they decide it, but as soon as we know more, or if there is an area of concern, we're going to be right here telling you about it. But in the meantime, no news on indoor dining. These restaurants are struggling to stay open as it is. Keep in mind, I know that a lot of us like to just have debates for the sake of having debates. This isn't a trade-off between whether or not somebody's making money or public health. It is a little bit of all of it, right? People need incomes. Those incomes pay for their bills. People have invested in support, in particular the small businesses, to stay open, have made enormous investments to support their employees, to put pay in people's paychecks in people's pockets, to keep our communities alive and thriving. They're all trying their best, and if we go backwards, really it's going to devastate so many of them, even more so than we've already experienced. So the goal here is to just be safe and considerate. And if you have other questions, feel free to write them in the comments section. Ice rinks, ice rinks can be open, but there's limited activity. So I know for instance, hockey, currently I think it's non-contact training can occur, but again, there's limited capacity and some safety precautions that they have to follow. We have a couple exciting things going on. We mentioned this, the Hudson Valley Renegades associating with the New York Yankees. We're going to be a New York Yankees affiliate. Very excited about that. It is going to require some investment by the county into the stadium. We know the way that works. There's direct revenue that we get, and then there's indirect revenue. So we do generate revenue through rent and the relationship we have with the Renegades themselves. We also generate indirect revenue. Individuals who come from outside the county, 60% of the Renegades fan base comes from outside Dutchess County. They spend about $1 million a year, several hundred jobs annually at the stadium, and we benefit not only from the on-site sales tax, etc., but from the multiplier that comes with economic growth and activity. So very excited about that. They'll switch, if you've been following baseball, they'll be moving from this New York Penn League, which will no longer exist, to what's referred to as the High A division, moving us, by the way, instead of 38 games at home, move to as many as 70 home games. So we're looking at a 140-game season, 70 at home, and the season would begin, assuming we can, in April of this coming year. We're also transitioning from Thanksgiving to the Hanukkah and holiday and Christmas holiday season. One of the things, both religions celebrate light in the value of light in the world. One of the things that our Parks Division is doing this holiday season is our Illumination Weekend, December 5th and 6th, 6 to 9 p.m. at Wilcox Park. First, if you're interested in displaying lights and actually being a part of the light display, visit duchessny.gov. You have to apply, and we'll get you set up, or you'll get yourself set up. But local businesses, municipalities, faith groups are invited, organizations throughout the community, all invited to set up your light displays throughout Wilcox Park. And then the rest of us can drive-through event. It'll be really exciting. So we hope you might participate with us on December 5th and 6th. 6 to 9 p.m. Exciting opportunity for us, and hopefully you'll be joining with us that weekend. If you have any additional questions, write them in the comments section below. Happy to get to any more we may have. I do want to jump back to the dashboard, and then I just want to reflect as we close up on let's look back in time a little bit. So as I said, 576 active cases, 32 individuals hospitalized, 176 individuals succumbed to the disease. Now, Just as a reference point, again, we've talked a little bit about this rate of growth, which is of concern. So we go back in time where today we're at 576 cases. 2 weeks ago, we were at 192 active cases. Just to show you the rate of growth we're seeing, 192 cases 2 weeks ago, 576 cases today. At our peak, we were at 1,860 cases. And I can tell you that there were moments where we were certainly rapid and we were growing pretty quickly. But this pace should be alarming to all of us. This is absolutely a moment of pause, and for all of us to be all hands on deck. Hospitalizations 2 weeks ago, 10. 10 individuals hospitalized, 32 today. And these are individuals that don't have alternatives because of either the severity of the case or their inability to provide for their own personal health. 32 individuals hospitalized. At our peak, we were at 108 individuals. That pace, that rate of growth is absolutely alarming. This is not meant to frighten anyone, simply to tell you where we are, and that we can slow this again by doing the same things we did months ago, which is, again, to just hunker down a little bit longer and focus on those basic safety precautions, and we'll be okay. So those are just they're sobering points that I think we want to be aware of. We will exceed 600 cases soon. We will likely get to over 1,000 after the Thanksgiving break if you look at the pace and where the cases are coming from. But we don't have to be victims of this. We have the ability to make certain choices that can slow the rate of growth, that can slow the transmission of the disease, and can ultimately help save lives. And I think that's where we'll end now. Do we have any additional questions? We have one more question we'll get to, and then we'll try to close up. Thanks very much. Georgia, what does the color coding mean on the dashboard map? Great. It's the scale on this map. I see. Okay. So depending on the color, it's the number of cases. So more cases in a particular municipality, the brighter the color. Yellow is less than 20, right? Up to 30. Thank you. I'm looking at what I thought was a 7. So, so under 20 cases, up to 30 cases is yellow. And then orange is under 60 cases, but up to 70, and that sort of beige is the in between, right? So you can see the darker the orange or brown, the more cases in a particular municipality. And if you look at our dashboard map, it does make some sense, right? Where is the population base? It's the southwest corner of the county up into Poughkeepsie, and to some extent Hyde Park, and that's where you expect the population base to be, and then in higher numbers. It's just a reflection of the total number of cases, which is important, but it's not the only thing that's measured. Because again, you have 50 cases in a community of 50,000 people. That is of concern. It is not necessarily the same level of concern as would be maybe 50 cases in 700 people or 800 people, or 1,000 like Tivoli or Millerton in population. So those are things that we pay attention to. The transmission rate, absolutely. And Georgia, thanks for that question. And it's good to watch and monitor. I do want to say this again. This county has done relatively well. I think that our approach has made sense. I know that many of you don't necessarily agree with some of the restrictions. I know some of you don't even believe that there is a disease. There is. COVID is a real disease, and it is impacting a lot of people. Yes, many will overcome it. But some will not, and that is the respect and decency we need to extend to one another. There are some people who don't know they have an underlying illness. There are some people who will succumb to this disease with underlying vulnerabilities, and the truth of the matter is, any life lost is a concern for all of us. But we do know that the disease is easily transmitted. It's contracted easily, and we are seeing again this rate of growth that ought to be alarming to all of us. It is a wave that is cresting, and our goal is to try to mitigate that, to keep it from crashing onto our community. And so this is a moment of pause right now, where again we're asking residents just to take those basic steps, and it's about being considerate. I'm not even going to, we can say it's patriotic, it's not patriotic. You can claim it's political, it's not political. It is considerate. Be considerate of your health and the health of the people around you. If you had a cold and your nose is running and your ears are itchy, you're likely not going to cough in the neighborhood of somebody you know or love. Here's the thing. This disease can take lives. So take the steps to slow its transmission. Take those steps to assist, to protect your own health and the health of family and friends, and we'll weather this yet again. Keep in mind, be safe while you're out there. If you're not feeling well, please don't risk your health or the health of others. Just stay home if you can. Certainly, we don't want folks going off to work or school if they're symptomatic. Please be tested if you think that you've contracted the disease. You might, like I do, have allergies. You might think that it's allergies. It may feel a little bit different. Get a test. Be sensitive. Take precautions. I've had a few tests myself. They are not the most pleasant, but nevertheless, we encourage you to do that. And then follow those basic precautions of personal hygiene, physical distancing, small gatherings. Keep it small, and wear a mask. When we do those things, we'll be safe. And in the meantime, stay healthy, be safe, and please, especially this time of year, be kind to each other. Thank you.